Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
For hormonal study, samples should be taken from the lateral wall of the vagina.
And for the cellular study, for studying the cells, we take the sample from the posterior wall of vagina.
Theoretically, gonococcus vaginitis can be seen in newborn females.
Because in the newborn females, there is transitional epithelium is present in vagina, whereas in adults, it is squamous epithelium. Gonococcus is resistant to squamous epithelium, so gonococcal vaginitis is not seen in adults.
Gonococcus vaginitis is seen in newborn females. Why is it not seen in the adults? Because squamous epithelium which is present in the vagina is resistant to the gonococcal infection. But if you see in newborn females, vagina is lined by transitional epithelium. So because it is lined by transitional epithelium, they are more prone to infection. Cervix to corpus ratio before puberty is 2:1.
thank you and thank you for watching.